This memorandum looks very professional, but I think it's shot through with ambiguities, and I think it's fundamentally flawed. For ambiguities, we've already considered conversion therapy. Now, I think this is used like a bogeyman. It's discussed as though it's a single discrete entity. I looked up bogeyman in Wikipedia and found that a bogeyman is a common allusion to a mythical creature used by adults to frighten bad children into good behaviour. This monster has no specific appearance, and conceptions about it can vary drastically from household to household within the same community. In many cases, it has no set appearance in the mind of an adult or a child, but it's simply a non-specific embodiment of terror. Conversion therapy is a bogeyman. There's a footnote in the memorandum which takes us to some small print which says that this is an umbrella term. It's a type for a type of talking therapy or activity which attempts to change sexual orientation or reduce attraction to others of the same sex. And in those terms it covers everything, from electrical and chemically induced conversion therapy of a bygone age, hopefully, to modern techniques including cognitive behavioural therapy. Now, if it is all-embracing, are all these therapies equally dreadful? The foundation of this memorandum lies in paragraph 2, in what it calls an informed position, which clearly means an underlying assumption. And the assumption is this: to try to change or alter sexual orientation through psychological therapies is unethical and, 2, potentially harmful. Now, if that foundation collapses, the rest of the memorandum is a puff of wind. It all hangs on those two things being true. So let's take the second issue first. Are these therapies potentially harmful? Now, it's a medical truism that every therapy that has an effect has a side effect. And recently we've been learning that even paracetamol, not just in overdose, but in normal doses taken too much over the years, can be lethal. Does this stop doctors from taking paracetamol? Or from recommending it to patients? No, of course not. In normal doses, the risks are very small, but it should be used sparingly. So we need to be very clear what the dangers actually are. Is therapy more dangerous than no therapy? Now, we know there's a suicide risk with therapy. Suicide is a common cause of death in young men. Has anyone compared the suicide risk with no therapy to the suicide risk attached to having therapy or to having gay affirming therapy, which now appears to be the only therapy that is being promoted? So a potential for harm is always there, even cognitive behavioural therapy. Some clients might embark on new activities as a result of that, leading to an accident or perhaps a coronary walking up a hill. Would we blame cognitive behavioural therapy for such a negative effect? So we need to know where the harm lies. Dermot O'Callaghan has repeatedly asked the UK Council of Psychotherapy to provide evidence that such talking therapies are not potentially harmful, but actually harmful. And they have persistently and repeatedly refused to answer the question, which is very odd. If there's good scientific evidence out there, why not tell us about it? Senior advisor at the White House has just announced that there is overwhelming scientific evidence that conversion therapy can cause substantial harm. Terrifying, isn't it? Well, why not tell us where the evidence can be found? Surely this is an emperor or perhaps a president who has no clothes. And if they cannot document the harm, can they answer the other question? Why is this treatment unethical? Now, the ethical offence must lie in the goal to be achieved rather than the means of achieving it. It cannot lie in talking therapies themselves. It could lie in the administration of talking therapies if the patient doesn't request it or has been shamed by the therapist into pursuing it. But as has been well explained to us, therapists are under moral obligation to respond to their patients' wishes and beliefs. And then it's also discussed in advance both the desired and the likely outcomes of therapy. So there's no scope for rash promises. Conversion therapy suggests a Damascus Road experience, radical change, a complete turnaround. Well, very few people experience that. What might be achieved is help for people who want it in managing or modifying intrusive desires to render them less powerful and less disruptive in their lives. It's unethical to help somebody. Is it unethical to help somebody modify sexual desires if they request it? Well, therapists attempt to do it regularly for people with adulterous desires, pornographic addiction that we've been hearing about, or even paedophilia. So is so-called sexual orientation some sacred turf that must not be walked upon? The memorandum claims that there's no good evidence that therapy works, which would call into question the ethics of using it. But the key word is good evidence, meaning scientifically rigorous evidence. And such research has never been done. So there's no good evidence that it works, and there's no good evidence that it doesn't work either. We just don't know. And such trials are very expensive. And many surgical and nursing procedures have never been tested with this sort of rigorous double-blind trials. They're decided on a common sense basis. Consider, for instance, appendicitis. No one's ever done a trial. We're having 500 people with an acute appendix and 500 in another group you decide not to treat. But you'd have to open them up. They'd have to have an anaesthetic so that they've got the placebo effect, they've had it removed, but the inflamed appendix is left there. Has anyone done that sort of research? No, of course not. And that sort of thing runs through a lot of procedures in the medical world. Of course, if the original statements of the Royal College of Psychiatrists are to be believed, sexual orientation is both genetically determined and unchangeable. Now, it's widely known that these things are not true. And so we complain to the college. And what do they say? Well, after 2 months, the college registrar acknowledged our letter and flatly refused to discuss it. And that's the last communication we've had from them. As A.A. Milne would have put it, and that, St. John, is that. Well, almost that, except that 10 months later they changed their public statement, conceding that sexual orientation is neither innate nor is it immutable. And so the scientific basis for this memorandum, it seems to me, is now shot. A recent paper on the causes of same-sex attraction, actually published this month by research scientists Dennis Alexander and Nell Whiteway in the April edition of Christians and Science and Christian Belief, which is the Journal of the Christians and Science organisation. They put it like this, and it's a long and detailed argument, and on the website there is a more detailed argument, presentation of it that you can get hold of. But they conclude, in men, genetic influences on same-sex attraction cannot be ruled out, although any genetic variants that do influence same-sex attraction will be of small effect, and there is no single gay gene. Furthermore, there's ample evidence that orientation can change, demonstrated particularly by Lisa Diamond's research. Change is more common in women than in men, and is much more common among male adolescents than in older men. And this probably has a lot to do with neuroplasticity of the brain. When adolescent desires, reinforced by repeated pleasurable experiences at a crucial stage in their development, lay down neural pathways and response mechanisms which in later life are very difficult to eradicate. And it does young people no favour at all, President Obama, please take note, especially when HIV rates are rocketing in young people, to tell them that the orientation they experience in their teens is fixed for life, when it clearly is not. And now they're going to be banned from getting any professional help. Now, by their own admission, the college statements are frankly wrong. Now, if this was merely a mistake, why wouldn't they just thank us for pointing it out and correct it immediately? So were these errors actually made in ignorance, because they just know less about it than mortals like myself? Or was it deliberate intention to propagate an agenda? Recently I spoke about this to a senior doctor, a fellow of 2 Royal Colleges, and he said he thought that the behaviour of the college was disgraceful, and that we should report the officers of the college to the General Medical Council. So Dermot and I have written a 14-page complaint against the former president of the Royal College of Psychiatrists, the college registrar, and Professor Michael King, who's the principal author of the college statements, and that has now been delivered to the General Medical Council, listing more than 20 examples of their failure to follow the GMC advice in their booklet, Good Medical Practice. And we await their verdict with interest. Thank you.